My name is Dr. Nikolov. I'm a plastic surgeon, and I've been practicing here in Beverly Hills at the Nikolov Center for Plastic Surgery since 1994. Morhpeaus8 is a technology that involves radio frequency delivered by pins into the skin, and the energy exit to plates around, thus heating up the skin and allowing for a great deal of skin contraction as well as significant improvement of the skin texture. The best part about Morhpeaus8 is the technology that allows me to change the pin length. As a result, I can treat different areas of the face or body with literally changing the length of the tips with a push of a button. I've used Morhpeaus8 all over the body. I started with using it on the abdomen to tighten some of the skin and improve the texture. Also, one of the things I found is that it also improves the stretch marks on the abdomen. So that's an added benefit. So today we're going to do Morhpeaus8. Here we have the numbing cream. It's been on now for almost 2 hours. And we're going to clean that off first, wiping it off using some saline, and then we'll clean off with 70% alcohol. Okay, so here we're going to go ahead and start. And I'll start at where the money is, which is what bothers her the most, and that's the middle of the abdomen. Here we're on the body setting where the pins protrude out 4 millimeters each time we do this. So that is a little bit deeper. Still overlapping 50%. Important to keep tension so the skin is tight. Generally, there isn't a whole lot of bleeding when we do this on the body. Of course, there is less blood supply. I'm at 35 watts here. And as a rule, I try to be a bit more conservative on the abdomen or body parts where the blood supply is not as great as it would be in the face. And that's simply because healing is impaired when the blood supply is limited. You see here almost no bleeding, and this is rather quick. It's not a procedure that would take a long time. Unfortunately, it's hard to see where you've gone before, so always pay attention and keep track so you don't get lost and miss an area. How you choose to divide the abdomen and where to stop is your choice. Here I'm just stopping at the belly button, and then I will do below afterwards. But that is truly your choice. As long as you keep track of it, it doesn't matter. Now, this same technique applies to what you will do if you did this treatment on the elbows or the knees. It is the same technique, same settings. Be careful in the arms with the needles protruding too much where all the nerves are. So you may want to back off and go to facial setting or less over certain areas. In the knees, not as much. And of course, when you treat knees, for example, not just where the loose skin is, you have to go a little bit above, because tightening of the whole skin is what allows the wrinkled skin right above the knee to go away. And that's just simply where the symptom is for laxity over the whole thigh. When you look at the body, I always think of recovery being about 3 times longer than it would be on the face. And with most devices, that holds true. With this device, it's been a little less than that. But again, less blood supply, longer healing time, and you have to apply less energy because it will have a harder time healing. This also works pretty well on scars. Not necessarily a primary treatment for scars, but if I see a scar, zapping it a few extra times. And now I'm gonna go in the other direction. The edges here, you don't have to feather the way you would do with a laser. So this is easy to do, but you can just turn off and not pay attention. But if you're in the right settings, you almost have to try to screw up. Post-operatively, we use Aquaphor immediately afterwards and at least twice a day until the patient has healed. After the healing process, a few days later, you can use a moisturizer, anything that doesn't irritate. And most importantly, don't go out in the sun. And I would say sunblock, but I prefer that you don't expose the area at all.